So this patient we are planning for 2 quadrants. One is the 3-6. Okay. Already the nerve is drawn. The nerve is very far away. Okay. So based on this panoramic image, what we can plan is we can place a single implant. Of course, we have to do prosthetically. Do enameloplasty for the mesially tilted 3-7. And before itself, we can check the implant carrier whether it is going inside. Okay. Provided there is no lingual undercut, you can place a longer implant. If there is a lingual undercut in the 3-6 region, then you cannot place a longer implant. You may perforate lingually. So that one thing we have to check CBCT. So whenever you are placing single implant for a single molar, better to select a diameter 4 or above. Okay, so for this patient you have to select 4, 4.1, 4.2. If you are selecting 4, it is from radius implant. If you are selecting 4.1, it is from symplectic implant. If it is 4.2, it is from bioline implant, compressive implant. The length is definitely more than 10 you can place. Okay, 10, 11.5, 12. More than 12 is not necessary. Okay, so this is the tentative plan. Single do enameloplasty for mesial enameloplasty for 3-7. Check the carrier whether it is fitting. Select a 4 or above diameter implant. The length is
10, 11.5.
No, more than 10 you can definitely place. Okay, the canal is far away. Why you are selecting 10? More than 10. It may be 11.5 or it may be 12 or it may be 13. Okay. If you are selecting 11.5, it is available with bioline. If you are selecting 12, it is available with symplectic. If you are selecting 13, it is available with bioline. If you are selecting 14, it is available with radius. Okay. So the plan we will confirm with the CBCT cross section. Okay. So this is the cross section. Okay, they have drawn already. It is almost 16 mm. Okay, so definitely you can place a 14 mm implant. 14 mm is available with radius or 13 mm with the bioline, whatever it is. So select, if you select a 4 or 4.2, crustally it will engage both buccally and lingual plates, it will engage. If you select longer implant, it will get more bone contact, more compression, nice stability. If you feel the stability is very less, you can go for the option of delayed loading also. Okay. But mostly these kind of cases, they work 100% perfect without any failure because the mesiodistal distance is very less. So the occlusal forces, it won't go that much. So definitely whenever you see mesially tilted 7, it is a short success because there is no cantilever. All the occlusal forces will go to the adjacent tooth also. So these cases are very straightforward and easy cases. Okay. Now we are planning for the right upper quadrant. 1-4 is missing, right? 1-5 is decayed. 1-6 also the doctor was planning for extraction. 1-7 there is a big cyst which is visible more in the CBCT, and 1-8 is also grossly decayed. Okay, so maybe because of long-term edentullousness, the 1-5 has tilted mesially. Okay, maybe extraction at a very young age. If you see lot of decay tooth, some habit, some wrong habit is there. Maybe lot of sweets or raw rice eating, something is not right. From the young age, the patient is having this habit. See, this patient lost the 4-6 with very young age. The 7 is mesially tilted and even closed the space. After the patient loses the 4-6, the patient losing the 3-6. Okay. Maybe in the time the patient is losing 1-4, but the patient is not stopping her wrong habits. That is the reason a lot of decay on root canal, even the 8 is decay. Okay, leave this thing. So 1-5, the tentative plan by the doctor is 1-5, 1-6, 1-7, 1-8 extraction and whatever number of implants. Okay. So how many implants? Say 3 or 4 implants. The main thing is 4-8. Okay, the 4-8 plane is very much upward, right? So both in centric occlusion and protrusion, this 8 distal cusp will give interference. So better to remove this 4-8 or do enameloplasty. But looking at the X-ray, the patient looks young age only. So the 8 may keep on erupting. Better to remove this 8 for the safety. So we are going to give 2 premolars and 1 or 2 molars. Okay. So the first implant will be immediately distal to the canine. Lot of good bone is there. Till the nasal floor you can go. Fortunately the sinus is not that much. If you see the sinus, there is some radio opacity here. Left side sinus is clear, but right side there is a sinus issue, sinus polypore granulation tissue that surely is due to the 1-7. The 1-7 periapical lesion is very close to the sinus because of the irritation, inflammation from 1-7. The patient might have developed the sinus issue. So 1-4 we can place either a axial implant or mesially tilted also. If you are tilting mesially, you have to tilt palatally also. Okay, because canine palatally there is a lot of good bone. So 1-4 implant either place straight axial or slightly mesial. But whatever it is, axial or mesial, you have to go along the palatal wall. That's it. Okay. Since it is a healed area, you can choose a compressive implant. Based on the width, you can select a wider diameter or shorter diameter. But since there is a long length, I prefer 3.75 from Bioline. You can select. The length probably will be around 16. Okay, 16 or 18. So length, how will you determine exact? By drill drop. So when you are drilling, you will feel resistance. That means you are reached the floor, nasal floor. Then you drill further. You will feel the drop, measure it, and that is the length. So tentative length is around 16 or 18. Okay. Don't go along the 1-5 socket because that socket is not in correct position. It is mesially tilted socket. Don't follow the socket of 1-5. Okay. So 1-4 you have placed one implant. Where is the second implant? So this is the 6, right? 6 mesiobuccal root is there. So palatal to the mesiobuccal root there will be bone. Okay. Again the diameter is better. Select 3.75. The length is depending upon sinus flow. So go. You will feel small resistance, not very heavy resistance, similar like nasal flow. The resistance will be very less. If you are not careful, you may miss resistance. Mostly it will be around 10 or 11.5, whatever it is. Okay, or 13 something like that. You will see the buccolingual cross section later. We are just planning with the panorama. So 3.75 into some length where the drop occurs. And then third implant, we can try placing in the palatal socket of 7. Of course, there is a lesion is there. We don't know whether some good bone is there. That we have to see the cross section, or after extraction you can check the palatal socket. We don't know whether the palatal root is present or it is a conical, all roots are fused. If all roots are fused, it is a disadvantage for us. But the 8 looks fused roots. That is not a good sign. Okay. But 8 you can place a pterygoid. Don't go along the socket, tilt slightly distally and palatally. You will get a very easy pterygoid area. Okay, so the one implant is 1-4. The second implant is in the mesiobuccal root palatal aspect. The third implant may be in the 7 palatal socket. Mostly it will be 5.5, 10 or 12. Any company will do, Implant and basal 5.5, 10 or 2. 8 you can place a pterygoid. So 1, 2, 3, 4 implants. It is more safer approach. Okay, placing a pterygoid adds a great stability to the system. If you don't want to place a pterygoid also, this case will work. Okay. So now you will see the cross section. Yeah. Now if you see the panoramic view, you can see the red lines. Whenever they are sending the reports, you can see like this. So this line now comes next to 6. No, between 5 and 6, these lines, the premolar 1-4 lines. Okay, you can match and see here. Okay, so between 5 and 6, that means 50, 52, 56, 58, something like that. Okay, so first, see now 52. Okay, see these red lines, there is a marking here, 2, 3, 4, 5, 6, 7, 8. Can you see the green color markings? So between 2 and 3, there are 5 lines. Between 5 and 6, it is divided into 2. Okay, that means 52, 54, 56, 58, 60. So if you want to see 1, 4, you have to see 58 or 56 something. Okay, now we will see. This is 52. Okay. The report they have written region 1, 4, 1, 3. That also you can see. So 52 is the 52, 54, 56 is the first premolar region. If you see the length as per the CBCT measurements, of course we cannot rely on this. It is around 15. Okay. Of course they have not included the nasal floor in the length. Okay. Okay, they have not included the nasal floor. You will go 1 mm into the nasal floor also. So definitely 3.75 into 16 will work. Okay. That too, if you tilt mesially, the length will increase actually. You may go for 18 also, but I will stick to 16, that is enough. So 3.75, 16 compressive for 1/4. Now we are coming to the 1/5. We are not at all considering 1/5 because the 1/5 and 1/6 they are very close. Okay, so this is the 1/6, right? This is the 1/6 area, right? This is the mesiopalatal, just palatal to the mesiobuccal root. You have got a good bone. The length is around 16. Of course, you cannot rely on this. So mostly it will be between 13 and 16. 3.75, 13 or 16. See the length they have measured till the sinus floor. But if the drilling goes towards the nasal floor, it will reduce, the length will reduce. But you will get a good nasal floor engagement. So 3.75 into 13 is for mesiobuccal root. Do not place implant in the mesiobuccal root. Palatal to the mesiobuccal root, start the drilling, you will get root bone. So palatal socket of 6 can be placed, better avoid, because mesiobuccally you are placing one implant. Palatal, if you place implant, these two implants will join hit each other. It's not a good idea. So we are going straight to the 7. Okay. See, this is the palatal root of 7. That is where the exactly periapical lesion is there. Right? But if you see here, the mesiobuccal root of 7, palatally there is good bone. So in 7 also, we are not using the palatal socket, we are using the mesiobuccal root, palatal to the mesiobuccal root. You have got good bone here. You see here. Okay. Is this 7? Okay. So mesiobuccal root, palatal to mesiobuccal root, or you can use the palatal socket also. But you have to curate the the periapical lesion nicely. Gently you have to curate. If you aggressive curate, you may enter the sinus. You can see the sinus floor. After extraction, see the tooth. If there is periapical granuloma. So you don't have much to curate because the granuloma has come along with the tooth. If nothing is there in the root, then the granuloma is inside, the periapical infected tissue is inside. So you have to curate. Curate gently you can place a 5.5, 10 or 12 in the palatal socket. Even if the stability is less, you don't have to worry if you are doing welding. Or if you don't want to place implant in the palatal socket, you can anyway jump into the mesiobuccal palatal area mesiobuccal root you can select. Okay, this is for the 7. Okay, these 3 implants are enough, but if you want to add some more stability, you can place a pterygoid. Pterygoid cross section is not available with this report. So this is the 8. No, if you go straight along the 8 socket, you will enter the sinus. Either you can place a 5.5 here also, or you can slightly tilt to distally and place a compressive implant. 3.75, 13 or 16 is enough. Okay. Of course, we cannot discuss pterygoid because there is enough information is not available here. But of course, here you can see, no, if you tilt palatally, you can have a lot of bone. And if you tilt distally, you will reach the pterygoid. Okay. So, what is the sequence of surgery? So, you will be giving a lay. You will be luxating using Coupland between 5, 6, 7, 8. Okay. Our main aim is, so what are the difficulties you may experience in maybe in extracting the 1.5 because there is no crown structure. But the good thing is the root is a conical root, it is short root. The 7 will come very easily, the 8 will come very easily because they are fused roots, periapical inflammation is there, so no difficulty. But the 6 may give trouble because the 6 may give trouble. So you should remove without fracturing, or if it fractures, you should be ready to section it and remove it. Or if you don't want to fracture it, starting itself you section the crown and divide the roots and take it out the roots. So after extraction, curating, gentle curating, then start the drilling for 1.5 and 1.6 mesiobuccal root area parallel. But before placing the 7 implant, you have to place the pterygoid. If you place the 7 implant first, you cannot drill properly. You cannot place implant in the pterygoid region. So place pterygoid first, then come for the 7 implant. Okay. Some doctors, they do the pterygoid first. Okay, because that is a challenging one. They do the pterygoid first, then they can do the other implants. So there is not much difficulty with this. These are the difficulties you may face during. That's